Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Infertility. Reasons of infertility include distorted anatomy due to adhesions or if there is inflammation which is impairing the folliculogenesis, uh, fertilization and implantation. The management if a female of age less than 35 years has come with infertility with minimal or mild disease, then we should do expectant management. Then if a patient, if the pain is present, if there is infertility and there is dysmenorrhea is present in the patient, then the results are better because if laparoscopy is done with esthesiolysis and implant fulguration, and this can be followed by intrauterine insemination or in vitro fertilization. If endometrioma is present, then remove the endometrioma and then do intrauterine insemination and in vitro fertilization. If there is mild or minimal disease, then we should try clomiphene citrate with intrauterine insemination for 3 cycles, and if this fails, then in vitro fertilization is done. If there is severe disease, then we can do in vitro fertilization. The most effective treatment of infertility associated with endometriosis is in vitro fertilization. Recurrence of endometriosis is common both after medical and surgical management.
thank you and thank you for watching.